Good afternoon, everybody, and welcome back. I'm going to wait for a little while for the room to settle down here. Hey!
Time for seminar.
Thank you very much. It's my great pleasure to introduce Cheryl Peters. Cheryl's a PhD candidate at the School of Population and Public Health at UBC, where she's studying exposure to ultraviolet radiation and sun protection behaviors in outdoor workers, as well as potential protective effects of UV radiation exposure on prostate cancer risk. She is also a CIHR Institute of Gender and Health trainee. Cheryl has been directing the Occupational Estimates Program for CAREX Canada since 2007, and she's currently the Occupational Exposures Advisor for that project. CAREX Canada is a national carcinogen exposure surveillance project run out of Simon Fraser University, the University of Victoria, and UBC. Cheryl also received her master's degree from UBC in Occupational and Environmental Hygiene when she studied occupational lung disease development in trades apprentices, and her bachelor's degree is from the University of Victoria, where she studied geography and earth and ocean sciences. Welcome, Cheryl.
Thank you, Sarah, and thanks everybody for being here. I'm really happy to be giving this seminar today. I do think that UV radiation is something that we don't often think about in hygiene, especially when it's to do with outdoor workers. In Vancouver, we tend to worship the sun because we never get to see it, but so we don't actually think about it as an occupational hazard, but I'm going to hopefully convince you today that it is one. I've broken the talk today into two pieces. So the first part is kind of a significance piece, so convincing you that skin cancer is a big problem. That's another thing we don't often think about in occupational epidemiology or epidemiology in general. Even though skin cancer is prevalent, it doesn't kill us very often, and so it doesn't tend to get as much excitement in the research community. However, it is a very big problem in Canada, both for the people who get skin cancer and also from an economic perspective. So I'm going to talk to you about how big that burden might be, both by showing some results from the CAREX Canada project that I was working on a couple of years ago. I'm also going to talk about some of the, well, mostly limitations, but some strengths of intervention research that's been done in occupational settings for skin cancer prevention. And I was laughing to myself as I went through my slides this morning because I know that the title of this talk is Challenges and Opportunities, but I do tend to focus a lot on challenges, so I'm going to try to be a bit more optimistic about opportunities as well. And in the second half of the talk today, I'll give you some preliminary results from my PhD, one of my PhD projects that is called the Outdoor Workers Project. This is an exposure assessment I did last summer in some outdoor construction workers, actually measuring their exposure to UV radiation in the Lower Mainland. So, part one. So this graph here is just showing you the new incidence of malignancies in Canada in 2013. So you can see 88,000 of the new malignancies in Canada were skin cancer. The majority of these are non-melanoma skin cancer, so I think it's about 82,000. Non-melanoma are largely not fatal, but they're very, very prevalent, obviously, and that includes both squamous cell carcinoma and basal cell carcinoma, and I'll talk a bit more about those in a few minutes. But the one that most people are quite familiar with is melanoma, just because it's the most deadly, and that's also included in that graphic there in the skin cancer part of the pie. The extent of the problem, the extent of how much work contributes to this is assumed to be large in Canada, but actually no exposure monitoring occurs. The only place that a lot of exposure monitoring happens is shown in the graphics on the bottom, and that's Australia. They have about a 10 times higher skin cancer rate than we do in Canada. Around over 400,000 people are diagnosed with non-melanoma skin cancer in a country of just 22 million. So much, much higher problem there. And so much more research and prevention work has gone into preventing skin cancer in Australia, both environmental exposure as well as at the workplace. So just to get us on the same page, you're probably familiar with this, but this is just what we're talking about when we talk about UV radiation. So UV radiation runs in the electromagnetic spectrum between 100 and 400 nanometers. So UVC, which is the most dangerous segment of the spectrum, is completely blocked up by the ozone layer, lucky for us. And so when we talk about solar exposure to humans, we're talking about UVA exposure, and you can see at the bottom of the slide there what UVA exposure is responsible for. So this is what gives us wrinkles, sunspots, and it has been implicated more recently in skin cancer, but in general, what's causing skin cancer and what's giving us sunburns is UVB radiation. It also has a number of eye effects, including cataracts, and it's been linked to ocular melanoma, so cancer in the eye. This slide, as you can see in this slide, and I'm going to talk about a bunch of stuff in this slide, this is some of the challenges that occur in the epidemiology and the etiology of skin cancer. The pattern of exposure really does seem to matter in determining the risk of various types of skin cancer. So in general, cumulative long-term exposure that we would think of for an occupationally exposed person is most strongly linked to squamous cell carcinoma and actinic keratoses, which are sort of the precursor to squamous cell carcinoma. Whereas intermittent exposure, and to a certain degree cumulative, but intermittent exposure is the one that's been shown to be more linked to melanoma, as well as basal cell carcinoma. Basal cell carcinoma is the most prevalent type of skin cancer, and actually recently in the occupational community, people have decided that yes, indeed, this is also linked to workplace exposure, so it's both an intermittent and a cumulative exposure, although it's less linked. There's a lower relative risk than there is for squamous cell carcinoma with occupational exposure. The exposure part is important with UV, but also there's a number of risk factors that differ by population that most of you probably are familiar with, but I'll just run through them. So, well, there's both personal and environmental factors, actually. So, having a paler type of skin, having light eyes and light hair, especially red hair, places people at higher risk. Having lots of moles or freckles. A family history can be important, though teasing that apart from just your skin color is difficult. The elevation at which you're exposed, so higher elevations have higher exposure. Your latitude, if you're closer to the equator, you're at higher risk. Reflectance, weather, there's a lot of different environmental and personal factors that go into determining your risk. As I said before, outdoor workers we know that they have a higher exposure than the general population. Estimates of this vary. The rule of thumb that people use is that they have twice as much exposure over a year compared to an indoor worker. But some studies have shown that they have 5 to 6 times the amount of exposure over a full dose year compared to somebody who works inside. And so we assume in Canada that it's large, but as I said, we don't do any sampling. I think this could partially be because there aren't any rigid occupational exposure limits for solar UV exposure. There are some guidelines that are about UV exposure in general, but they're usually adhered to just for artificial sources, such as welding arcs. I'm going to go through these slides quickly because I don't want it to be the focus today, but this is some work that I did for CAREX. The CAREX Canada project, for those of you who are not familiar, is a national surveillance program for occupational exposure to carcinogens. And it looks to estimate how many people are exposed at work, where they work, thinking of it in terms of industry, what they do in terms of their job, where they live and work in Canada, and what levels they might be exposed to. And so as part of this project, we did an exposure estimate for solar UV, and actually this is how I got interested in this field in general, because I realized how little information we have. This method slide is actually, because we don't do any exposure monitoring, it's kind of hard to say, well, who's highly exposed and who's not highly exposed. So this is the algorithm that we came up with to divide people into different exposure categories. It's a bit of a novel idea. We used a list of jobs that are expected to be exposed from Australian programs, and then actually we used career selection websites that do actually say on them how much time you're expected to work outside to pull out the ones that are at high exposure, so people who are outside more than 3/4 of the time. So that's the high group. Low is people that are outdoor work is less common or less intense. You'll see in the bottom right there, truck drivers are included in that group. You wouldn't think of them as being exposed to solar UV quite a bit, but actually truck drivers have a pretty high incidence of occupational skin cancer on their driving arm. So that's why they're included there. And then the moderate exposure is a bit of a mixed bag. So the job title might have people who work both inside and outside, or it's a job where you're outside and inside as, in equal measure or in some mixture of measure. These estimates for all of our carcinogens, but this one in particular, you can look at it by level of exposure, by what a job title is, industry, province, and sex. So the results here, and actually these are published if anyone's interested, I've got the citation up there. So we estimated that about 1.5 million people are exposed or working out of doors in Canada. This is a huge amount. It's about 9% of the working population, and is second only to shift work in terms of all of the carcinogens we've looked at in CAREX Canada. Most people exposed are men, and this does actually play out in skin cancer rates. Men are a bit more likely to get skin cancer, especially squamous cell carcinoma, which is the one that is most linked to occupational exposure. we can look at exposure in the CAREX estimates by industry, and so each one of these pies that you see here is proportional to the size of that industry exposed, and the colors in the pies are linked to exposure level. So the darker the color in the pie, the higher the exposure level. So you'll see, perhaps not surprisingly, the people that we've flagged as exposed in the farming industry are almost always outside, so they basically make up the whole pie in high exposure. Again, you can see all of our estimates by occupation as well, so I've just highlighted a few, but it does really reflect those industries that I just showed you. So the biggest group being construction, trades, helpers, and laborers. And this is also an interesting piece for the second half of my talk, where I decided to do my research project on construction workers because they are the biggest group and because they've been very underserved by traditional exposure assessment for UV. A lot of exposure assessment for UV is done in recreation workers, like lifeguards and ski lifties. So it's a different type of environment where there's other competing challenges in terms of prevention, so they're an underserved group and the biggest one in Canada. This is just actually something I put together the other day. It's a back-of-the-envelope calculation on what the burden of non-melanoma skin cancer might be to the total in Canada. So the incidence data there, the new cases of non-melanoma, is from the Canadian Cancer Statistics for 2013. So there's the 82,000. Those attributable fractions were pulled, actually, Paul Demers at the Occupational Cancer Research Centre in Cancer Care Ontario in Toronto is doing a project that I'm also involved in, looking at the burden of occupational cancer in general, and we will be addressing skin cancer for that project. And so he's pulled together a few studies that have actually tried to do this, and the attributable fraction, for people who don't know, is the proportion of cancer of that type that could be eliminated if we removed occupational exposure. So it's a bit of a hard thing to estimate, but there's the ranges that you see there because there's been 4 different studies that have addressed this. And so I've calculated a range just saying, okay, well, if there's 82,000, how many of those could have been from work? And the range shows us maybe about 1,000 to over 7,000 of those cancers could be related to people's occupation. So this is a big deal. Non-melanoma skin cancer is very, very rarely submitted to workers' compensation systems. In fact, in BC, which makes up of that total, between 100 and 800 of that total is from BC alone. And BC, WorkSafe BC has only received 23 non-melanoma skin cancer claims in a 10-year period. So a couple times a year, even though the problem could be much bigger. So if I'm thinking about prevention, how we might work with folks, what are they already doing to protect themselves, and how could we maybe increase this protection? So the main message from this slide is that some outdoor workers protect themselves, but a lot of them do not. So in the top study on the first bullet there, that's a study from San Diego. The lower range, the 40% of people protecting themselves, which included, I believe it was using at least 2 of the protection behaviors. So this could be something like wearing a hat, wearing a long sleeve shirt, using sunscreen. So 40% there was construction workers. That's the low end, and then the high end was transportation workers, so truck drivers. So they're doing a better job protecting themselves, but actually the difference is mostly explained by what was enforced, and here enforcement basically just means what their uniform was. So if they had long sleeve uniforms, that they were automatically protected. We don't have much data from Canada, but the bottom bullet there is a study out of Canada. So this is from the second National Sun Survey, and they found, these are just of people who reported that they work outside for part of their job at least. About half of them are wearing some protective clothing, half are wearing hats, half are wearing sunglasses. But interestingly, for about 30% of them, the only prevention tool they're using is sunscreen. This is good. The message is good. We want people to use sunscreen, but actually it's the last line of defense because, in truth, most people don't use sunscreen correctly. When you put sunscreen on, you're supposed to put a full ounce, so a shot glass size each time, and you should be reapplying it depending on the UV at least every 2 hours. And a lot of workers are putting it on in the morning, counting that as sunscreen use, and not ever reapplying it during the day. So we don't want to see people just using that as their only form of protection. I also want to mention, too, that sun protection in the workplace can vary substantially with the workplace culture, and the single biggest predictor of that is the gender breakdown of the workplace. So women and men protect themselves very differently, so a lot of these prevention initiatives really need to take that into account. So job sites that are mostly women, so a lot of recreation settings are done in women, and this is another limitation that a lot of the studies that have been done among women and have not been done among men. But women tend to wear sunscreen more easily. They wear lip balms that have sunscreen in them, but they don't wear hats very much, whereas men do tend to wear hats more at work. So there's these interesting cultural differences in the workplace that can influence how a prevention campaign should be designed. So what has worked before? People have been trying to do skin cancer prevention in the workplace since about the 70s and early 80s, especially in Australia, where a lot of this started, like their Slip Slap Slop campaign started in 1981, and they're just starting to see some benefit to that now. So this is actually the results of a recent meta-analysis done in the US, and they do these meta-analyses on a number of different cancers and prevention tools, but this is one that's specifically about occupational settings as a place to do skin cancer prevention. So they have a task force that meets. They started meeting in 1996. The last time that they reviewed the occupational setting for skin cancer in the year 2000, they found that of all the interventions that had been done in that 20-year period, there was no good evidence to say that any of it had worked at all. But recently, this summer in 2013, they did another review, and there were 8 new studies, and actually they did tip over to the side of saying, yes, this could be useful. These are the 4 types of approaches that an intervention would have to use to be included in their review. So an educational approach would be something like using a brochure. Activities could be modeling or demonstrating behavior, so actually showing this is how much sunscreen you have to put on and this is how often you have to do it. An environmental approach would be providing a shade structure, or a policy could be requiring sun protection clothing, for example. So this is the results of the community guide, where they did say, yes, changing these interventions had enough evidence to say that changing behaviors and reducing sunburns did occur, but I do want to point out, so these are the 3 outcomes, and those PCT-PTS means percentage points. So sunscreen use, they found 8% increase in sunscreen use. Hat use, another around 9% increase over the intervention periods, and the sunburns, a median decrease of 5%. So pretty modest. And the long-term prevention effectiveness, not super certain. Another challenge of the comparison with this meta-analysis is that studies use different data collection methods with variations in what the questionnaires are asking, with the wording, with the recall period they're asking workers to remember, and also what measurement scales they're using. And there's a whole section I'm going to talk about exposure assessment and the challenges and how that's impacting our ability to do good prevention work, and even to actually find out the etiology of skin cancer from an epidemiologic approach. So this exposure assessment is really has limited our ability to do a good job here. This is another review that was done recently. They had slightly less stringent criteria of what they would include as a study, but they came up with the same recommendation that yes, the workplace is a good place to do skin cancer prevention work for the same reason. So they maybe increased their protective behavior. They started using sunscreen a bit more. But again, the data quality point here, so the 16 studies that they've reviewed that came out since 2000, just 3 of them were ranked as having high data quality, when 13 of them were moderate. So the moderate the reasons that they ranked them as moderate were usually that there was a low or unknown proportion of workers that agreed to participate, so they weren't even sure who had said no, so what type of a population are they even doing these interventions in, and they had a very high number of dropouts, particularly in the construction industry. The construction industry is quite transient, so getting people to stay in an intervention long enough to actually see if they've changed their behavior is very difficult. And the mean follow-up time for these studies was between 3 and 12 months. So sustained behavior change, we don't really know if this behavior change that led to a fewer sunburns is actually sustainable. So these are some challenges in skin cancer prevention, and this is both from the idea of how we do prevention work, and also how we do epidemiology, and how we even do industrial hygiene, how we even assess workers' exposures. If we think that a worker population that we are working with is exposed, how do we even guess what they're exposed, what levels they're exposed at? So for evaluation challenges, I'm really talking more specifically here about these cancer prevention meta-analyses, so the limitations of these interventions that have been carried out. So to reiterate, there's this problem with length of follow-up, especially in an industry like construction where you're going to lose a lot of people. This is also played out in the moderate quality of studies where loss to follow-up was a very important issue that could be especially problematic in those at highest risk or these biggest populations. I'm also referring to this short time span for evaluation types. It's just very difficult to understand what the impact on skin cancer rates is going to be from these short follow-up times. For measurement challenges, I'm going to talk a lot about exposure soon, but with outcome, actually, I should mention that skin cancer, melanoma skin cancer is captured very well in our cancer registries. Non-melanoma skin cancer is almost not captured at all, and this is true actually for a lot of the Western world, and those statistics from Canadian Cancer Society are actually just projections from the 3 provinces that do collect data on non-melanoma skin cancer to the whole country. So, in fact, most of the country doesn't collect this data at all. Non-melanoma skin cancer is often treated in an outpatient setting, so it doesn't get captured in the cancer registry very well. It does in British Columbia, which is great, and in 2 other provinces, which I think are Manitoba and Nova Scotia. So they've taken the data from those provinces and projected it. So even doing epidemiology on non-melanoma skin cancer is difficult because we don't really even know that much about who's getting it. And with cultural challenges, I did mention this before, this can be attitudes of the workplace, it can be location. By location, I mentioned this at the beginning, but in Canada, most places are not, well, not most, but some places are not blessed with very much sun, including Vancouver, and so convincing a worker that this is a risk factor rather than an extreme luxury can be very difficult. And often people that choose to work outside because they like the sun. So changing these attitudes in a workplace are probably influenced how basically ineffective these interventions have been as well. And I think we need to address that if we're going to make any kind of change. So I'm highlighting the exposure assessment part, just for a good hygiene perspective. So I tried to lump the ways that we've assessed exposure to UV radiation and solar UV radiation in particular into 3 groups. So first of all, which is almost always used, these other tools are not used almost ever, but questionnaires or job exposure matrices. And in fact, the CAREX Canada estimates I just showed you are a form of a job exposure matrix saying, okay, what's your job, what's your industry? Okay, yeah, well, you're going to say you're exposed. Questionnaires can be, or epidemiologic studies often, particularly in studies of melanoma, have just used this yes, no. Is a person outside or not? Okay, they're at risk, they're not. It could be a self-report, and you can see it's pretty small, but I'm going to show that survey in a little bit. But that's usually what people ask is, how much time on a typical day are you outside? And breaking it into these time chunks. People sometimes also measure instances of sunburn. This is not a bad way of actually looking at those at basal cell carcinoma or melanoma, because they have been more linked to an intermittent exposure that you could measure by a sunburn. Intermittent is often people who are sun worshippers on the weekend, that they work inside, or people who take vacations in the wintertime. Lots of people in Northern Europe as well as in Canada getting sunburns on their vacations. Environmental measures, and I'm going to show a more detailed example of all of these, but this is just a map. It's of the U.S. because I wanted something current, and Canada's all green right now because we're at low risk unless we work on a ski hill. So you can see that the closer we get to the south, the higher. This is a UV index. I'll also explain that concept in a minute, but you might be familiar. It comes in our forecast. UV index was actually developed by Environment Canada and now is sort of the world gold standard for communicating risk of sunburn to general populations, and there's lots of different apps you can get on your phone that will tell you, you got to get out of the sun, or you've got to use protective equipment. And so anything above a UV index of 3, you should be using protection. Anything above 6, and you're at a very high risk of sunburn. But also, I have a little sort of area, the equivalent of an area sampler on the bottom there. These have been developed for UV, and actually some people use them just in their regular lives to say, oh, my kids have been outside for too long, I better get them inside. But they actually are very buggy and error prone, so they haven't really been used in exposure assessment in the workplace. If you're really trying to get an objective measure, they're just so error prone that errors up to 50 and 60% have been found. So yes, there are tool that's available, but not the greatest for occupational exposure assessment. And then the third, which we would think would be the gold standard, it actually hasn't been used very much. People are definitely moving towards developing better tools to do personal dosimetry or personal monitoring, and there's 4 different types. The chemical, biological, and electronic are all actually a dosimeter, and there's some cool new studies coming out that have actually gotten around the self-reported time spent outside by actually measuring someone's forearm skin color at the beginning of the summer and measuring it again at the end to see how much sun exposure they're actually getting. So I'm calling that personal dosimetry, but it's a bit of a unique one. People will forgive me, I'm not a physicist, but I'm going to try to explain a little bit about what measuring radiation is not completely analogous to a typical hygiene measure, like I'm going to go measure benzene in the workplace, because it's very much linked to the biologically effective section of the spectrum. So we really need a tool that can measure what's actually going to harm us. The whole UV spectrum is not super harmful when we're thinking about skin cancer, and so how do we create monitoring devices that can take this into account? So CIE is actually just the French acronym for an international body called the International Commission on Illumination, and they've created this weighting function for how you should look at exposure. And exposure to radiation, actually, we usually think of it in a dose over a period of time, rather than just a single exposure point in time. In this way, you could get too much UV exposure if the UV index is very high and you're outside for 15 minutes, or if the UV index is quite low but you're outside for 8 hours. That dose is actually equivalent. And your risk of getting skin cancer from either one is the same. So the CIE spectrum here mimics the erythema, and erythema just means skin burning, so what's going to give you red skin. It mimics the erythema effectiveness of UV radiation, and the irradiance of each wavelength is weighted by the weighting factor. So you can see UVB is from 280 nanometers to 315, and so the shorter the wavelength, the more energetic it is, and the more weight we give to that in the spectrum. So if we take this CIE-weighted irradiance from each wavelength and we add it up over time, you get this CIE-weighted irradiation, which is a dose. And I'm going to, the units of that dose are joules per meter squared, so it's the unit of energy over space. And I'm going to, most of the ways that I will show the data from my research project in the summer is by SED, which is a standard erythemal dose, and that's just 100 joules per meter squared, and it's a standard that people use across this industry, this very small industry. And just for reference, an SED between 2 and 4, it very much depends on the person and their risk factors, but between 2 and 4 is enough to cause sunburn in a light-skinned individual. So I'm just going to, a couple more details about the exposure assessment methods. So this is actually what most people are trying to make the gold standard for doing occupational studies, if you only can ask 10 questions, what should you ask? And this is what they've come up with that you should ask. And so just to give you a sense that it's still, this is what is primarily used for exposure assessment. So how long are you outside? And you can't really do an exposure assessment of UV if you don't know something about other risk factors. So it's different from other hygiene or like airborne contaminants in that way, because I can't look at two people who are both exposed to benzene and say, well, that person's at more risk. But with UV radiation, you most certainly can. So it's very important to collect both that exposure data as well as this additional data so that you know what that person's risk is it's mostly based on their skin color and hair color, but other things as well. This is an example, this is a real example that I'm actually using in my other project on prostate cancer. These maps were developed for me by Perry Heistad, who's a graduate of SPPH and is a current professor at Oregon State. He and I are working on this project, and he's created these maps of UV irradiance data from satellite data. So what we're going to do here is actually take the job exposure matrix that I've created for CAREX, saying, okay, well, you're a construction worker in this industry, so your exposure is high, and actually rating it using these maps. So saying, okay, well, you're a construction worker in Newfoundland, we'll keep your weight at this, or you're a construction worker in Calgary, we're probably a lot more worried about you, as you can see. So the one on the left is a 10-year average of UV exposure, so it incorporates also wintertime exposure. And the one on the right is a daily average for the month of July, so that's why it's so much more intense there. For dosimetry, these are the 4 different ones that I mentioned before. So the biological ones are neat, so they're actually usually spores, and once they're irradiated, they die off at a predictable function. So you can actually look at UV dose using a biological spore. This is a bit of a new thing to use in occupational settings. It's mostly been used to sort of measure how effective hoods are that people are working at with artificial UV, but I think it's kind of a neat idea. They also have ones that you just put bacterial DNA on a film and measure DNA damage. So there's some cool ideas in exposure assessment there that are coming up. The most common one, though, is a chemical exposure, or a chemical dosimeter. And these are just measuring a predictable color change Polysulfone is the chemical that they use. It's a polymerized chemical. And these have been used, they were invented in the late 70s. And this is basically what's been used for exposure assessment. They're good. I mean, they're good. So they measure a dose over a whole day, but basically because they're this photosensitive film, if you don't want to be measuring someone's exposure, they have to be covered up all the time. So taking care of them is difficult, and they can't discern any type of peaks in exposure. It's just sort of, this is your whole day exposure. So they're not bad, but people might be interested in some more looking at peaks and valleys, or if there's specific tasks that make your exposure higher. And so this is what electronic dosimeters are all about, and that's what I use in my study, so I'll show you mine later. But this is the Sun Saver. This was developed in Europe and has been used in some studies there in ski lift operators. But again, these are not really commercially available. This one, I tried to get my hand on some of these and couldn't. There's not really a lot of commercially available options. That's the other thing about the chemical ones, also not really commercially available, so people are making their own dosimeters in their lab. So comparability across studies becomes difficult to compare. And then this more unique idea of measuring a change in skin color I already mentioned. You can also measure vitamin D levels. Vitamin D is created in our skin from the same range that gives us a sunburn, so the UVB. This is a neat idea, but actually you can't detect really high exposure because our skin's ability to make vitamin D just maxes out after not that much sun. So it's a neat idea though. So I'm just going to summarize my challenges bit of this talk, which is good, and we're on schedule. So I think the challenges of both doing exposure assessment for this, for doing prevention for skin cancer, and even for epidemiology, is that number one, there's a lack of awareness about UV radiation from the sun as an occupational hazard. It's very, I mean, people do know about it as an environmental hazard, and definitely there's been a lot of, well, I wouldn't say a lot, but there's been more success in the environmental setting, specifically in preventing kids from getting exposed. That's certainly been a benefit to these prevention campaigns in an environmental setting or a school setting. But as an occupational hazard, it's not really received a lot of awareness. In some ways, this is competing risks. You know, you're a construction worker, you're probably more worried about an injury or your exposure to asbestos or something falling on your head than you are about getting a sunburn. And so that is a bit of a risk communication barrier. In these intervention studies, it's unclear what to measure. So do we measure a decrease in sunburn? Well, that's probably good. We know that means you have a less exposure, but we don't know exactly quantifiably how much that links to a reduction in skin cancer, if anything. So doing these interventions and seeing what works becomes quite difficult, especially over these short time periods. The epidemiologic challenges I've mentioned a little bit, but I'll just elaborate a bit more. So with melanoma, actually there have been some studies that show that outdoor workers actually have a lower risk of melanoma than other people, even though they have high exposure. And so this has created a lot of controversy. However, the thinking in the dermatology community is that this is probably just due to poor exposure assessment or poor control for other factors, and that it also could be one of histology, so that perhaps there are specific melanomas, because there's a wide variety. Melanoma isn't just one cancer, there's a wide variety, so perhaps there are some that are more linked to occupational exposure and some that are not. So, and melanoma is one that also has a bit more of a genetic component, so it could be why we're seeing these fuzzy results. But if we don't have a good exposure assessment, our results are going to get biased towards the null probably anyway, and so there's been positive, negative, totally null studies with melanoma, and I do think that as we refine these exposure assessment methods, we will probably see it coming out as a risk factor working outside. And then fourthly, the exposure assessment challenges, namely comparing across studies, especially even when someone uses a questionnaire, people have used all different times. So is it, this is between 10 and 4, or is it between 8 and 5, or, it's very difficult to compare across those studies. And even just within developing tools like dosimeters, there isn't a gold standard. There isn't one best thing to do. So it's very difficult. And just in addition to this, in Canada, since we've never even measured UV exposure anymore, there's a lot of pushback to say, well, yeah, that's a problem in Australia. We know that. They're doing something about it. But we just don't get enough sun here in Canada to really worry about it. And so part of what I wanted to do with the Outdoor Workers Project is to see if that was true. I mean, we don't really know. We know that Canadians get skin cancer a lot. Maybe it is just from their vacation exposure or, the thinning of the ozone layer. It could be, it certainly partially is. But what I really wanted to do was to measure exposure. So get some dosimeters, go out and measure exposure. So these were the objectives of the Outdoor Workers Project. Firstly, to characterize UV radiation exposure in BC's outdoor construction workers, because as I mentioned before, they're an underserved group that haven't been studied very much at all. And secondly, to understand the determinants of UV exposure. So are there certain tasks that cause someone to have a higher exposure? Are there certain job titles? Are there certain job sites or characteristics? And so this is the reason that I ended up choosing dosimetry, because if I use a chemical badge, it just shows me a full day. It doesn't show me about anything to do with tasks. So this was my interest. And actually most of these pictures, except for one, are all from my field study this summer. So the Outdoor Workers Project has three main data collection pieces, and actually all of these can be considered a bit of an exposure assessment, really. So the recruitment of outdoor workers was via their trade unions, as well as companies that had outdoor working populations. Data collection was last summer, as I mentioned, between July and September. So workers wore this UV dosimeter. This is the actual one that they used. For up to 5 consecutive work days. The measurements were recorded once per minute between all the hours of 8 a.m. and 5 p.m., which is when exposure kind of comes up to about a UV index of 2. The dosimeters measure UV using a sensor with a spectral response that matches the erythemal action spectrum for human skin, so it's weighted with that function that I showed you earlier. They were either worn on the lapel, on the hard hat, or on the wrist, so workers had a choice. Dosimeter data was converted to UV index measures by calibration. Calibration was done at an Environment Canada site in Richmond, where they have a Brewer spectrophotometer, it's called, and it's in actually the international network of UV and ozone prevention. So they were calibrated there. And then standard erythemal dose was calculated for each workday by integrating over all of those UV indices. Workers also completed a questionnaire that had risk factors for skin cancer, demographics, and they also completed these activity diaries, and I have some more information about all three of those pieces. So this is the dosimeter that I use. It's called the Mark II. It was developed by a researcher in New Zealand. He's an engineer. And they're wireless and data logging. They can store over 1 million data points in just 2 megabytes of memory, so that's great. They're fully programmable, so you just tell them when you want them to sample. They don't have to be running all the time, and they'll go into a sleep mode at night. They can sample as frequently as every 8 seconds if you really want to bang your head against the wall with a lot of data, or up to every 18 hours. I did once per minute, which was still a massive amount of data. And they last for a long time, obviously, depending on the rate of sampling. They're just small, they only weigh 20 grams, and they measure exactly in the range of radiation that we're interested in, mostly UVB. They do require regular calibration, and in the bottom right, that's actually them getting calibrated in Richmond. The questionnaire, it incorporated a whole bunch of different things, but it does have those questions on how many hours you spend outside, which actually is quite useful. I'll show you a graph later how that correlates with their exposure levels. It has information about their skin type, including the pigmentation of their skin, the freckling, their hair and eye color. There's a bit on demographics. We also ask about past exposure, which is measured in childhood sunburns, and also their tanning and sun protection behaviors. I also have information on their occupation, their current job, and if their current job was not their longest job, I have information on their exposure at their longest job as well. These are their task diaries, and this is a bit, I won't show any results on this yet today because I haven't really dived into it yet, but this is an actual one that was filled out during the study. So they filled one out every day with the tasks they were doing and what they were wearing. This was modified actually from an Austrian study of farmers who were exposed outside. So I've changed it to match the construction industry better. So shade, was it straight sun? Was there a tree there? Did you have some building protection? Were you inside an excavator, for example? So I'm just going to get into some results. So this is the recruitment table. I'm just showing you outdoor workers here. I did have some controls of indoor workers in the study, some of whom are in this room. So I'm going to show a little bit of results from them later, but this is just for the outdoor workers. So we recruited 78 people. Most of them were men. Most of them were Caucasian, and they were quite young, mean age of 38. A lot of them reporting yes to childhood sunburn. I've shown here at the bottom some more of their personal characteristics. Skin types 1 or 2, those are the ones that are most susceptible. The skin type scale goes from 1 to 6, 1 being the most at risk of skin cancer, so the palest with the lightest hair, to 6 with darkest skin, darkest hair. So not that many people with the palest complexions, which makes sense because a lot of paler people don't select to work outside all the time. So what we would expect. Just to show you the amount of data and the variability in what you'd see in a day, this is a typical day. I just chose it randomly. This is actually July 11th, and I picked a few workers randomly to show you what their exposure patterns look like through the day. So this is, again, this is a measurement once a minute through their workday. The red squares is available UV. That was actually from that Brewer spectrophotometer in Richmond. So you can see it bounces around, but this is exactly the path that we expect to see of UV radiation, peaking around solar noon, which in Vancouver at this time of year is about 1:15, 1:30. That's another thing a lot of people don't realize. They think noon is the time that the exposure is highest, but it's actually solar noon, which here is later because we're more north. So the biggest risk that we face in the summer in the Vancouver area is between the hours of 1 and 2 p.m. So you can see some bouncing around there. That just means maybe the cloud went in front of the sun or something like that. So just to look at these workers, so the carpenter in the green triangles, you can see those periods of space at the bottom there where he's inside, which makes sense for his job. So it's a zero measurement when people are inside because there's no UVB getting in there. Sometimes UVA can get inside, but UVB is generally blocked. And since these are measuring mostly in the UVB range, that's why we see that pattern. The purple crosses, that's a traffic control worker, and you can see that this worker did not have their badge on until I came there and reminded them. So you can see the morning they don't have any exposure there, and then it bops up, and actually this worker had some of the highest exposure in the study overall, and you can see the measures popping up there. Just for reference, as I mentioned before, I'm going to talk about SED, because this is just by UV index. SED, tallying up their dose for the whole day, and remember, between 2 and 4 can put a person who's pale at risk. So worker number 1's SED this day was 6, number 2 was 5, and for worker 3, the traffic control person, it was actually 11, even though we missed that whole morning exposure. So a very high-risk exposure. Okay. So here I'm showing you the results by job type. So this is just a crude, I will be doing more analysis on this and splitting people up into their job groups better. This is kind of like an amalgamation between industry and occupation. So you can see a definite difference by job type. So wildlife officers on the right there having the lowest exposure. These are workers who work at the airport, protecting mostly geese out there. And then on the left-hand side, marine construction workers who are on land had the highest exposure. The mean for the study overall was about 2.3 SED, so in the range that could be considered risky for pale-skinned people. But exposure is going up quite high, and these bars are the 95% confidence intervals. And I have some more raw data to show you here. And this also includes the controls, so you can see. So yeah, we had 78 workers, outdoor workers, and the number of measured days we got from that was 346 days. I also had 13 controls, and we have 46 exposure days there. So this whole data set is 250,000 data points. So again, the mean SED for outdoor workers was 2.3, and for controls, again, it was under 1, which is what we would expect for people who are inside. But you can see actually that with the controls, there were a couple workers that were getting up into a reasonable exposure, the maximum of 2.7. This particular worker was someone who bikes to work, so getting some exposure on their way to work. You can also see the variability. The standard deviations are quite large here. And the maximums that we see, I actually have to do a little bit of correction on this data, especially that 19.2 SED. That was in a welder, so I think that there could have been some extra UV radiation picked up from their welding arc. So I know the dosimeter actually maxed out and produced that. So that's an overestimate of probably what their real exposure was. So take that one with a grain of salt. The UV index results at the bottom. UV index, again, we don't usually think of it as a mean because it is just a one-point measure in time, and it doesn't convey risk in exactly the same way. But I still like to show it just so you can see, yes, definitely outdoor workers' exposure was tenfold compared to the indoor workers. And you see some quite high maximums. 12.3 is reflective of this maximum as well, so it's probably a bit high. We usually don't get above a UV index of 9 in Vancouver, so it's probably a bit of an overestimate. I mentioned this graph before just to show you along the bottom is the hours spent outside between 10 and 4. So 6 would be basically you're outside all day. And we do see a pretty good trend that people who say they're outside all day are having the highest exposures, except for whatever's going on with those people who say they're only outside 2 hours a day and their exposure is higher. So I haven't looked at which workers those are yet, but it's kind of interesting, and I'm pleased to see that the dosimeters seem to be doing a good job. And people are doing both both. People are doing a good job at saying, yes, I'm outside all day, and here's my high exposure. I'm going to talk just a bit about some of the prevention that people are doing, what their behaviors are at work, and this one actually is about their sunburn. So I've grouped people here. So this is again their self-reported time at work outside. So up to outside up to 3 hours, up to their all day. So that's the whole time between 10 and 4. And a couple things about this. So on the y-axis is just number of people, so just raw numbers. So striking about this, the people who are outside all day are getting a lot of sunburns. So this is self-reported sunburn the previous summer. In fact, only about 30% of the whole study said that they didn't get any sunburns last year. So almost everybody's getting at least one sunburn. And when we look at people who are getting multiple sunburns and even excessive sunburns, it's much more common in those people who are outside all day. All right. So I'm showing here, this is busy, so I'm going to walk you through it, but I'm showing the self-reported sun protection behaviors of outdoor workers, both when they are at work as well as in their leisure time, just to see if there's any differences there and to see what they're doing and where we could maybe improve. So the positive takeaway from this graph is that a majority of workers are protecting themselves, often or always at work. So those light-colored bars often or always doing that sun protection behavior, and it's percentage on the y-axis there. So you see people are really wearing sleeved shirts, 80% at work, and even 60% in their leisure time. Sunglasses are also very prevalent. People are using sunglasses at work, which is great, protecting their eyes from cataracts and melanoma. However, the other striking feature about this that you can see is that the two behaviors that people are never really doing is sunscreen on the far left and then shade seeking. And interestingly, these are the worst and best things that you can do to prevent yourself from getting a sunburn and to prevent skin cancer. So shade is the best thing, and sunscreen is the worst thing. So they're not doing either one of them, really. Some people are. And you can see actually that more people are using those behaviors, at least for shade seeking, in their leisure time. So just maybe those are places where we can maybe start to impact an intervention. I should wrap this up quickly. So the strengths and limitations of the Outdoor Workers Project in particular, the strengths are that, surprisingly, this is the first study to objectively characterize UV radiation exposure in Canada's outdoor workers. It's kind of neat that these dosimeters are new, they're novel, they're wireless, and they're reusable. Actually, one of my committee members is hoping to use them for studies in environmental exposure. They're certainly amenable to that. They're easy to use. And also, I think another strength of the study is that it really raises awareness and starts to build capacity for the development of prevention programs in construction workers. I had a great deal of buy-in that I wasn't necessarily expecting to get, and the workers are certainly worried about their skin cancer risk. So that was a surprise to me, and I think it's great, and this could be extended to do other workplaces in Canada. The limitations are the cost. These dosimeters are not cheap. They cost about $250 a piece, which is not too bad considering they do last forever. But still, their utility in large studies for epidemiology, not great. We know that it's the same thing for personal sampling in any case. We do have to have good, population level tools to be able to do epidemiology, but. This also was a smaller study than planned, so when I say cost here, I wrote this grant 5 times, and we wanted to get a big enough study to actually get 300 workers. I eventually cobbled together enough funds, and we did this study for 15 grand. So it was actually not that expensive to do this study as a whole, to get 78 workers and all that exposure data, so not too bad. Its limitations is comparison to other studies. So these dosimeters are new. I wanted to use them because they are time-stamped and you can look at peaks in exposure, and so I think it's justifiable that they're not that comparative. And I think that people will start to use dosimeters like this one more, and there's a lot of interest in getting more people to use them so we can drive the cost down. So this was a special purchase. Martin Allen is the person in New Zealand who invented them. When I first contacted him, they were not commercially available. During the course of me writing the grants, they became commercially available, but it's just a tiny little New Zealand company that makes them. So if we can get more people using them, the cost will come down. So that would be great. And we did have some data loss, but actually relatively low. The dosimeter only for one person did it malfunction in the outdoor workers. Everything else was fine. I lost a couple. They broke sometimes, but they're easy to put back together, so I still didn't lose too much data that way. So actually they were pretty good. Not too much in the way of failure. So for the Outdoor Workers Project, I think what I hope I've showed you is that there is the potential for high solar radiation at work in the summer in Vancouver, and the levels do differ quite a bit by job site and also in between person. I didn't show you that data, but there's a wide variety of variability with between person and between job sites as well. some positives and negatives. Workers are selectively using sun protection already, which is good, but they're choosing clothing over sunscreen and shade more often. And most of them, despite this protection, most of them are still getting sunburned. 70% of them still getting sunburned, even though they're trying to prevent a sunburn. And to conclude the study overall, or the talk overall today, this is a big problem, I think. 1.5 million Canadians are likely exposed to solar UVR on the job, and our evidence suggests that they're not using great protection, and so there could be some inroads there. Measuring exposure objectively is required to do accurate risk assessment, and it's actually not really been done for this exposure before. So I'm hoping more people will start to pick this up, and let's see how exposure actually varies on a personal basis in Canada would be useful. Exposure to solar UVR is high enough in Canadian settings to be a concern, which is what I assumed from the beginning, but it's a good piece of evidence where a lot of people, a lot of pushback at the beginning said, I don't really think this is a problem in Canada. I think this suggests that it definitely could be. And the burden of occupational skin cancer could actually be quite large. So that's my slides. I think I've just gone over a little bit, so that's not too bad. But I would like to acknowledge my supervisory committee, Mika Kuhan, Sunil Kalia, Paul Demers, and Anne-Marie Nicol, and especially all of the companies and the unions and people that helped me get this study going, and the Outdoor Workers Project participants themselves, who are absolutely lovely, and a multitude of funding sources, including CAREX, who's funded by CPAC, and Michael Smith, CIHR Skin Research, and CIHR Institute of Gender and Health that fund me, and the Canadian Dermatology Foundation that funded the Outdoor Workers Project. Thank you.
Thank you very much, Cheryl. We'll take questions.
So I'm just kind of curious. The sun exposure for the construction workers in Canada that you measured, how does it compare to a similar group in Australia? The reason I'm asking is, in Australia they get more sun. Maybe they are better at using sun protection, and maybe their exposure is actually lower.
Yeah, I mean, that's a good question. So their exposure is definitely much higher. There can be SEDs, you know, I don't want to say exactly, but definitely orders of magnitude bigger, so closer up to 100. Certainly the exposure is worse. You're right that they have much better prevention campaigns there, that it started about 30 years ago, because they started realizing, well, our skin cancer rates are going out of control. And indeed, in all of the Western world, skin cancer is either the fastest or the second fastest after thyroid in terms of growing incidence rate. So it's not slowing down. It's increasing by quite a bit, including in Australia, although the increase has gotten smaller in Australia, probably because of these prevention campaigns. But speaking about occupational exposure in particular, Australia has started to put more regulations in place requiring employers to do more. So either changing their work schedules so that they are in the shade in the peak exposure times, or providing sun protective clothing, as well. The equivalent of the Canadian Cancer Society there, they provide sunscreen for free as well. So if you go to the beach, it's just sunscreen everywhere, and workplaces are the same. So they've done more in terms of prevention, but the nature of the exposure is such that we're not going to be able to get rid of it altogether. People are still going to have sun exposure, and in Australia it's still much higher, even though they are doing some more preventive work. But the exposure is just so much more overwhelming than it is here, but it's been difficult.
I'm going to take an online question first. This is a two-parter. The first part is, do you know what month of the year people's vitamin D reaches a minimum?
I don't know in particular. I think it's probably, I would guess it's probably January, but in Canada, definitely getting some sun exposure in the winter, I should have said, is very important. And taking vitamin D supplementation is great. In the summertime, we don't really have to worry about it. If your skin is out if your forearms are out for 10 minutes, you're going to get enough vitamin D. But in the winter, it certainly is an issue. Yeah.
All right. And then the second question was, do you have a sense of what the relative risks would be between outdoor and indoor working populations, and is there any evidence of a dose response?
I don't know what the relative risk would be, and I think those comparisons are difficult. And again, it speaks to the exposure assessment problem, and that how do we tease apart what somebody's workplace exposure is versus their non-work exposure? People try to do it, but in general, it's pretty hard to control for, and a lot of it is so driven by beliefs. So I think probably like more qualitative research would need to be done in terms of, I mean, this outdoor working population, just, anecdotally in this group, there's a few people who were redheaded and were getting sunburned every single day, but most people would identify as people who are sun worshippers anyway. They like being in the sun, they're not going to wear any sunscreen, and they end up getting the highest exposures. Like, I don't know, I mean, I did say earlier that we know what the exposure difference is. It's maybe 2 to 5 times the exposure levels of outdoor versus indoor workers. Translating that into a skin cancer rate, I don't know, and it's probably in part due to the fact that we don't really capture the skin cancer data very well in the first place. So doing those studies is difficult.
I'm just wondering, has this increase in skin cancer been linked to the ozone layer depletion issue?
Yeah.
And has anybody sort of shown a direct link, or how well do those two factors correlate?
I'm not sure if they've shown, I mean, that's definitely one of the hypotheses. I don't follow that literature as closely, but I do know that is why, and this is well known, that's why Australia's skin cancer rates are so much higher. It's partially that they are just, the way that the Earth turns around the sun, they're closer to the sun in their peak exposure in the summertime, whereas we're sort of ticked away from the sun in summer. But they also have a thinner ozone layer in the southern hemisphere than we do in the northern hemisphere, and so exposure in general in the southern hemisphere is higher than it is in the north. So I don't know if it's probably been calculated, because I do know that in general, but yeah.
I'm just wondering, so for where you use the standardized questionnaire, were there any questions sort of on the subjective, like from the workers themselves on how much they were exposed, and if so, like how did they correlate to the data that you got from the UV dosimeters?
So how much they said they were outside, or?
And how did that compare to like what they're actually being exposed to?
Yeah, so that was that graph I showed, I think, if I'm understanding you correctly. So the people who said that, yes, I'm outside the whole time between 10 and 4 had the highest exposures quite clearly. So there was a bit funny in the lower end where there was some people who said they weren't outside definitely had the lowest exposure, but there's a bit of mixing up in the middle of people saying I'm outside 2 hours versus 3 hours versus 4, in that the people that were outside said they were outside for 2 hours had this exposure that was higher than that for 3, and it was more comparable to those people who said they were outside 4 and 5 hours a day. So I'm not sure what's going on there. I work personally with everyone in the study, so once I look and see which people those were, maybe I can take a guess that they're underestimating, or maybe they think of themselves as an indoor worker more than they actually are. It could be people that are sort of in and out a lot. So a lot of them worked at a shipyard in the construction site, and so they could be inside or outside, and so maybe they just thought they were inside more because their job is sort of mixed. I think that's probably what's going on there. But in general, it did seem to correlate quite well. But certainly, the highest exposed people identified themselves as high, and the lowest exposed people identified themselves as low. So crudely, it did work.
Can I just follow up on that? I was wondering, if you're outside for 2 hours, but you're always outside at 3 and 4 p.m. versus always being outside at 10 to 11 p.m., are you going to have higher exposure?
Yes, so the timing does matter. So you're going to get the most sort of SEDs for your buck. Not that that's a good way to look at it, but you'll get the most dose by being outside between, say, 12 and 2. And then even though, the afternoon actually in Vancouver the exposures stay higher for longer. I'm not really sure why that is. I might actually talk to the Environment Canada folks. So it's a bit lower in the morning, and maybe it has something to do with moisture in the air. I'm not sure. So yeah, if you're outside in the early morning versus in the later afternoon, those exposures will be lower. But if you're outside for longer in those times, the data suggests that, maybe it is those 2 hour a day people are just outside from 11 to 1 or something.
Yeah, I just wondered if lunch factors into it, and they always go out for lunch.
Yeah, most of the people in the study had lunch at 11, so it's before the peak exposure time happens, but that's a good point. It could be that those people who say 2 hours, they go outside, right in that peak time, so that it's popping their exposure up.
Thanks, Cheryl. Really nice talk. I just wondered if you started thinking about or have thought about co-exposures. Are there occupational exposures that act synergistically with sun that might photosensitize people, or?
There certainly are, and so, yeah, I do have some data on that from the questionnaire, actually, and that was added in the pilot project that I did with Vanpile, actually. So a lot of them, they were thinking about their exposure to the sun, but a lot of them were worried about creosote. So we did collect information on if people worked with creosote or not, and if they did, for how long. So I'm interested to see that, because creosote is both a cause of skin cancer and also makes you more susceptible to sunburn. So that's one thing we have information on. We also asked the question about if people had some type of photosensitive skin, and I didn't think that anybody would, but a few people did report that they had some sort of disorder, and I think that we asked, do you have this, and if so, what is it? And some people did say that they had different skin conditions that made them more susceptible to getting sunburn. So I have that information, but we haven't looked at it yet.
So Cheryl, should we be worried about the anomalous measurement? So it's a new measurement technique, and you found a measurement that is extreme. So, do you know if that measurement corresponds with at least somebody who's outside all the time, or with environment data, and it's just a little bit of measurement error, but it's an extreme situation?
Yeah, so this, I didn't mention this before, but these dosimeters are actually, you can change their sensitivity. So I set their sensitivity for what I expected the UV index values to be in Vancouver in the summer. So they basically just give you just a numerical output, somewhere between 0 and 1023. So you just want to try to make sure they don't go to 1023, but you want to get the broadest setting that you can in order to get variability. So you don't want to always have them set, extremely sensitively, because you'll just be shooting over the top every time. You don't want to set them so that you can't see any variability, because all your numbers are between 0 and 100 as well. So there is a bit of, fooling around with them to make sure that they work. And in general, most of the measurements that I got, most of those raw measurements that came out were between 0 and about 800, which is exactly what I wanted to happen. But then this is just one worker that maxed out at 1023 many times, and he works on top of a paving machine all day, every day. So he is going to be someone who has high exposure. And then with that additional fact that he also welds sometimes, I think is what just pushed it beyond. So he was an anomalous exposure. Like, he definitely has the highest exposure. I think I've just overestimated his exposure a bit, because the dosimeters are picking up some of his welding exposure. But yes, he was already high, so probably his measurements would have already been 800, and then it just pushed him up over the edge. Yeah.
Okay, guys, thank you very much. We've actually run over time, so let's give one last round of applause here for a great talk. Thank you very much.